Anya's story, how common is it in your own experience, your practice?
Unfortunately, it is a common story where the symptoms are somewhat vague, a little bloating, some pelvic pain, some back pain, and we tend to brush those things off. We're busy, we're living our lives, we're not thinking we have an illness, we're thinking we're getting older, I have a little ache and a pain. And the body does hide a lot. I often tell patients that a lot can be going on under the waters that we don't see. And so oftentimes by the time a patient presents, they are stage 3 or stage 4. As you alluded to, the majority, 75% of patients, when they walk through my door, they're stage 3 or 4 at the time of diagnosis. And so that's not something that I can impact at present time. Certainly, that is one of the holy grails for ovarian cancer, finding that precursor lesion, detecting the disease early. But right now, where we are, the reality is 75% of women are advanced stage when they come in.
So with that fact, and unfortunately it's very true, are there specific red flags for an individual woman, or obviously potentially her family, to help advise her as to what those red flags may be in this situation?
Certainly the bloating, weight gain, increase in the abdominal girth or distension can be a sign of fluid building up in the abdominal cavity, and that can sometimes be a a sign of a more advanced disease when someone presents. Unfortunately, a lot of the symptoms, as we said, though, don't point to a specific illness or body part, and so it sort of has to be a little bit of self-awareness that this symptom's persisting, it's not going away, and listening to the body to say, okay, something's not right here. And I think that takes a self-awareness and also a courage to say, I need to face whatever this is that's bothering me.
So Anya, turn to you. Your experience, what you've gone through, any potential recommendations to other women out there who were where you were 15 years ago?
Right, but even before looking back, I can now trace back that I've always had some problems in the gynecological area, lots of inflammation. I went to a gynecologist many times. In fact, at one point, after I read about the importance of CA-125, I asked my GP to perform CA-125, which at that time was 9. That's normal. I'm sorry that I didn't follow up and repeated CA-125 marker. I think that it should be part of any physical for every woman.
From the perspective of a baseline
From the perspective of baseline, yes.
I think it's a very interesting comment, because it's not for at that point, what you're describing is not to look for the disease, but you sort of know where you are, such that if you did have a symptom or concern, you'd know where you were potentially. It's an interesting thought.
I would, especially for a certain group of people like Ashkenazi Jews, who's genetically have a higher incidence of mutations, BRCA1 and 2 mutations.